Today I'll be assessing my patient's heart and lungs. I'll be using my 4-year-old for this assessment, and then pretending he's an adult. Before I start, I'm going to perform hand hygiene. I'll be providing privacy for my patient, and then position him comfortably for the procedure. After I introduce myself to him and explain the procedure to him, I will be asking for his name to identify him with the two-person check, and have him to verbalize his name and date of birth to me. So my patient actually presented with chest pain, and so I will be providing assessment of the heart and neck vessels to my patient. But before I start, I'll be assessing my patient's level of quality of pain, the for the onset, the start time, the duration, and then how often the pain was, and for those factors that actually bring about the pain and those factors that makes it better. I'll be assessing my patient for the quality of the pain. What does the pain feel like? And then I want to know if the pain is localized or it's spread to other part of the body. I want to know the intensity of the pain. I want my patient to rate his pain, to know the intensity of the pain. I want to have my patient to tell me if he has had any medication for his pain, when he had the medication, and the side effects of the medication. And then I want to check my patient's understanding about his pain, and then what does he think causes the pain, and then if the pain is affecting his activity of daily living, and if he has any concern about the pain. So aside all of this, I want to still check my patient if he's had, do you have any nausea or vomiting? I want to ask. My patient said there's no nausea or vomiting. And then I want to ask my patient if there's any difficulty in breathing, if there's any dyspnea. And then I'm going to ask my patient if he has had any injury before, if there's any stress and anxiety. My patient actually verbalized stress, and then he actually verbalized that there's palpitation as well. He said he has no cough, and then when I asked him for his past medical history, he has not had any history of hypertension or heart disease before. My patient has not have any history of diabetics or anemia as well. When I ask him for any past medication he's taking or current medication, he has some medication for over the counter, and then yeah, he had some medication over the counter, and then for smoke, he has been smoking and he has not been exercising himself very well. So when I check my patient's um, history, I discovered that for he has been living a sedentary lifestyle as well. So if I'm going to start my assessment on my patient, I've already performed hand hygiene and provide privacy for my patient. I've already cleaned my equipment and gathered my equipment. It is ready. So I want to actually check my patient's neck vessel. So I'll be checking my patient's I'll be auscultating my patient's carotid artery. I'll be checking my patient's carotid artery at the I'll be auscultating the carotid artery of my patient at the angle of the jaw. So if you can turn your head like this. So if he's an adult, I will have more room to do this. So I'll be auscultating. I'll be placing my stethoscope. So auscultate at the angle of the jaw. Then I want to move his neck to do that at the mid cervical. and then I want to do that at the base of the neck as well. So while I'm doing this, I want to listen for any bruit, um, any bruit. So after checking my patient for all of this, I want my patient to actually exhale. Can you breathe in? Good. Can you hold your breath? Breathe out. Hold your breath. Breathe in. Okay, breathe out. Hold your breath. Good. So after this, I want to palpate my patient's carotid artery. But if I'm palpating my patient's carotid artery, I'm doing that just one at a time. I don't want to do that together. So I'll be palpating the carotid artery. Okay, so hold on. So I want to do this gently too, so that the blood flow to the brain is not compromised. Okay, I want to palpate this. Okay, so when I'm palpating the carotid artery, I want to check my patient's carotid artery. I want to make sure it is symmetric, and I want to make sure that I can listen to the carotid artery without any abnormality. And then I want to actually check my patient. I want to auscultate my patient's heart. So I will be auscultating the aortic valve. I will be doing that at the second intercostal space, the right. And then I will be checking for the pulmonic valve. I'll be doing that at the second intercostal space as well, to the left. And then I'll be checking for the tricuspid valve at the fifth intercostal space, to the left. And then to the left of it as well, still on the fifth intercostal space, I want to check for the mitral valve. So if it's an adult, I'll be able to do the counting very well. So when I'm auscultating this, I want to actually be sure to listen for any abnormal sound. And before auscultating, I will actually tell my patient of the procedure so that he's ready for that. And after listening to the valve sound, I want to auscultate for the looped up sound, the S1 and S2 sound. The S1 sound is heard more at the apex, while the S2 sound is heard more at the base of the earth. So I'll be listening to the so the normal heart rate for an adult is between 60 and 100. So I listen to the S1 sound at the apex of the earth, and then I listen to the S2 sound at the base of the earth, where it is louder. The S2 sound is louder at the base of the earth, while the S1 sound is louder at the apex of the earth. So the first sound, the lob sound, is S1, while the top sound is S2 sound. So when I'm doing this, I want to actually be sure there's no abnormal sound, there's no murmur, and I want to be sure I'm not listening to any blowing, swooshing sound. And right now I cannot hear any abnormal sound. So if the pattern of the sound is irregular, what I'm going to do is actually to assess the assess for the pulse deficit by actually counting the apical pulse, and then checking for the radial pulse at the same time, and then counting it. So I want to check the symmetrical, if it is symmetrical, and then I want to count it and then check for the difference between both. If it is not symmetrical, if it is not the same, then I want to check for the difference between both to know the pulse deficit. So I want to be sure that the rhythm of the earth is actually regular, and the rate is within the normal range between 60 and 100. So my patient, I've assessed my patient, and then if I'm going to write any nursing diagnosis for my patient, because my patient presented with pain, I'm going to be diagnosing for activity intolerance that is related to pain, and then I will be saying that the evidence is actually shortness of breath. So since the pain interferes with activities of daily living, according to the questions and the answer he gave, then I'll be giving the nursing diagnosis on activity intolerance that is related to pain, which is like an evidence of shortness of breath that was presented. After my assessment, I'm going to position my client comfortably. I'm going to perform hand hygiene, and then I'm going to document my findings. Thank you.